Hi everyone. Hopefully you can see my slides and hear me. Okay, so yeah, as Kate said, I'm just going to give a bit of a whistle-stop tour of what we've been up to at CORC over the last year or so, and also take us through some things that are coming up.
Sorry, Nick, you've got two big black boxes on your screen. I think it's where you've got the participants tab and your toolbar at the top.
Okay. Sorry about that. Okay, so I'm just going to do a bit of introduction and context because I know many of you, I can see lots of familiar names that are here, but other people may know a little bit less about what we do. And then also as we go through the kind of developments, that'll give you a bit more of an illustration of the type of work that we do. So if you don't know much about us, I'm not going to go through this slide in any great detail, but I think it gives you an overview of the type of things that we do. And I know from comments that Lee's made already, we have a very sharp focus on how we measure outcomes, but also lots of things that sit around that. And very much, as Kate said at the start, a real focus on how we build and understand evidence about what's going on for young people and how we can support their mental health and support their mental well-being, and the role of kind of measurement and evidence gathering within that. So we're a relatively small team. I think helpful to put some faces to some names on here. I think what's really worth pointing out is that we're quite a diverse team with quite a lot of different skills and experiences that we bring to the work that we do. And we see that as a real advantage for us because all of those different experiences we can bring together, and many people are kind of multi-skilled and can work in different spaces and doing different things. And that really helps us to be quite an agile little organisation. But we also sit as a team within Anna Freud, and there are huge benefits to being part of a larger organisation as well. So in terms of kind of setting us up, it's probably helpful to just reflect on the sort of current context in the world in which we work. I don't need to tell anyone here, I'm sure, that we've had a recent change of government. And we know that that will mean change, and it'll mean change within the sector. Still emerging, I would say, for what that looks like. I think we know that some of the kind of financial constraints that we've been experiencing over the last few years are likely to continue for some time. So we're still going to be working in that field. But we also know that it feels like there's a kind of shift in focus and perhaps thinking more broadly about children and young people's well-being as well as their mental health in a range of contexts. But notwithstanding the fact that we know that the amount of need and the range of need that we're seeing amongst the younger population is really increasing. And that's very much the context in which we're working. I think as a team, and all of us here at CORC are very aware of what that context is, and we're really well connected to understand what's happening and what's changing. And we think there are really great opportunities. And the advantage of a small team is having that kind of agility to shift and change. So we're able to respond as we go, but we can't do that without you. So do help us to do that and tell us what will be useful. So in terms of what's been going on over the last year, I think as I've worked here a few years now, I think the breadth of the types of services and organisations that we work with is definitely broadening. I think our core work has always been with NHS services, lots of work with education settings of all kinds, working with community providers, particularly voluntary community sector, and increasingly in that kind of youth justice field, youth crime and violence, and also an increase in our work with families, particularly around early intervention. So I'm going to go through some of the things we've been involved in over the last year or so. So in terms of our work with schools, a large part of our audience, I know there are some people from schools here today. We very much advocate for and support schools to use some of those measurement tools and questionnaires that are really well embedded in mental health settings in creative ways within school settings. And from talking to schools and talking to parents and talking to young people, we've spent a lot of time kind of refocusing on what our offer is and how we can support and help schools. And what we've done is we've gone from that huge bank of outcome measures that those of you that are familiar with our website will know, to really try and narrow those down to a set of measurement tools that we feel are really appropriate for use in a school setting. And basically, we've put them into some resources. We've created a lot of guidance to support that, to really help schools embed this kind of evidence-informed approach. So that might be gathering evidence about what's going on for young people, but also gathering evidence about the difference that they're making. There's so much support that goes on in school. And what we want to do is help schools to really evidence the impact that's there. So within those 5 booklets that you saw on the previous slide, you can see some of the areas that are covered. You're probably thinking, well, these aren't just things that schools do. And I would say absolutely right. And we really do hope that now we've developed these resources and the step-by-step guide that goes with it, there's application for it in other contexts as well, particularly with voluntary community sector organisations. I think there's lots that they could learn. So if you haven't had a look at those, we've pushed them through our newsletter. Do have a look, and any feedback always welcome. As I said, we've increasingly working in the kind of youth justice field with a focus on preventing youth crime and violence. You can see on the screen some of the projects that we're involved in where we're doing that, and that's working around the country and with a variety of different types of organisation to work on this. And I think what we're really seeing is how a sort of multi-agency approach works in this sector. And really looking at where support embedded within a community is the thing that makes a difference. And that can be by bringing together different voluntary community sector organisations, using what they know about young people, their local insight into what's going on within communities, really, really helpful. We're also learning that, you know, it isn't just about supporting the child. I don't think this is news to anyone, but it's becoming really clear in this work that it is about supporting the child, but it's also supporting families. It's also around making sure they've got somewhere to live and supporting with housing and really addressing all of those other needs that may be there for that young person, that are factors that may be playing into some of the things that we're seeing within communities. And very much linked to that, with that child at the centre, is that it feels like those trauma-informed approaches that I know we've been talking about in the sector for quite some time are really showing some promise here. What we do see is that the type of system change that this maybe requires, and particularly seeing impact on reduction in crime and violence, that's longer term. But what we're really seeing is that by focusing on mental health and well-being in the short term, we're starting to see changes, and we know that improved mental health and well-being can have a really strong impact on those crime and violence outcomes. So, again, working with families, we've done a number of projects working with families, including families of young children, families where there's conflict, parental conflict, be that parents who are together or parents who are apart. There's lots of things on our website about the kind of projects that we've been looking at that very early start work, so around perinatal mental health and supporting in the early years of childhood. And we're learning with all of the projects that we do. I think what we're learning is there's a really diverse workforce that's working in this field and supporting families, and actually developing that expertise. The importance of training and professional development for that workforce is absolutely essential, and also really well received by that workforce, that they're really keen to develop their understanding and to develop the support they're able to offer. We do know that support isn't equally accessible, and we know that for some particular groups, those kind of seldom heard voices, that actually that support isn't as accessible for families, and perhaps the nature of that support isn't quite what those families need. So really focusing in within this work in really hearing those voices and ensuring that we respond and adapt in the support and provision that's there. And very much at the heart of what we do here at CORC, really seeing that delivery can be supported by that, and building evidence, evaluation and monitoring, very much those the bread and butter work that we at CORC do can be really helpful. Needs to be planned, and it needs to be carefully thought out, so that it's manageable and kind of matches with the ways of working in this kind of work, but can be really, really helpful in terms of delivery. And very much linked to that, the kind of broader community support, very much a focus on early intervention. And I think isn't new within the last year. This is very much where we have been working. The increase in things like social prescribing, the increase in targeted intervention for mental health and well-being, and be that in youth services. The work that we do with Plan UK is very much based in kind of youth services. The project that we say there about Breathe Magic, that's school-based and pupil referral units. But lots of really different and creative ways of supporting mental health and well-being, very much with a focus on well-being. And the work, and we'll hear from Fran later on about that kind of system-wide work, and where bringing those organisations together can be really helpful in terms of making a difference. And the place, and again, Fran will talk about this, that where we can do that kind of large-scale data collection, sort of large-scale school surveys, that can be really helpful in giving services something that they can respond to and understand, but also using that kind of data to understand the difference that's being made. So some really large banks of evidence being built up, but really seeing how they can be used on a localized way. So building that evidence base. And I think we're definitely hearing from the provider services here about the increased use of outcome measurement there. So often kind of light touch wellbeing measures rather than the kind of classic mental health measures. A lot of use of like the short Warwick-Edinburgh scale and things like that. Okay, so what's coming up? These are things to look out for, and you'll see these through our newsletter and other things. We're always working on measurement tools. We're always working on how the information that we get from measurement tools can be more useful, broadening people's knowledge and understanding of the tools that are available and how to use them. Very much at the heart of what we're doing. We've currently, led by one of our members, Tait Valley, really working on the eating disorder examination questionnaire to look at how we can understand reliable change within that to help services understand what difference they're making there. Always open to those pieces of work. And I think linked to that, really focusing in on what good practice looks like in services. And this is something that we support our member services with and others. In how they develop practice. We have our best practice framework, which many of you will be familiar with. We're going to be looking at that and thinking, yeah, just checking in on it and how we can build guidance around that to further support all of you. We know there's a shift into digital across all aspects of the world, but in outcome measurement. One of the things that we'll be working on in that area around digital is with colleagues within Anna Freud, the POD tool, which is an outcome measurement tool, new version of that's being rolled out currently, and we're building a support package with that POD team to support services that use POD, but lots of transferable learning for services using other platforms. And we've always been about sharing data and gathering data, and when working on projects like Be Well, gives us access to really large data sets that we can use in interesting ways. We've got a piece of work going on currently with the SWAMWebs, the short Warwick-Edinburgh mental wellbeing scale, it's used in the Be Well survey. There's tens of thousands of responses that we have access to there. So we're doing some analysis with that data to provide kind of benchmarking and comparator data that will really help services understand how the difference they're making compares with what they'd expect to see in a population. So lots coming up. A reminder that we are a membership organisation. We do much more than membership. And it's been great. You can see these are members that we've, in the last year, who've joined us. So you can see people from actually all over the world, really helping, working with us helping them, but also them being part of our kind of broader community and helping us to understand what's going on in different areas. So welcome to all of them. If you're interested in membership and you want to know more, drop us a line. And always like to do a shout out for our training program. We run these all the time, just keep on the website. They're 90 minutes, they're online. If you're a member, they're free and low cost if you're not a member. My shout out to you here really is, what would you like to see more of? Are the things you think are missing from that training offer? We're always reviewing it. We're always trying to understand it better. So do let us know if there's anything that you'd like to see. So I'm going to stop there. Hopefully that's given you an insight into what we're up to and some things to look out for. And thank you for your time.